I'm so excited to be joined by my next guest. Many people have seen the undercover Epicenter nurse, Erin Olszewski. Is that it?
Pretty good.
Most difficult name on the internet. Erin, how are
Yeah,
you?
I'm good. How are you doing?
I'm very well. Glad to see you. You and I were in touch by email a bit when your movie first came out. You are the undercover nurse who is an Army veteran who came to New York during the height of the pandemic, and you were stationed at Elmhurst Hospital, which the
Yeah.
New York Times and other sources tell us was the epicenter of the epicenter. Why don't you share with our audience, Erin, explain exactly what you discovered there?
So I guess I traveled as, a travel nurse from Florida, and this is during the height of the pandemic when everybody was still trying to figure out what was going on. And, when I got there, I expected to go to work right away. And, if you're going into a war zone, you get right to work. And so I ended up sitting around for 3 days. So I thought that was kind of like my first red flag. So if they needed us nurses so bad, and this is such a, catastrophe, then why was I sitting around for 3 days? And, there were nurses that got there before me who were sitting around for 18 days. So this is interesting. But when I ended up getting into the hospital, it took me honestly a shift to realize that what was happening behind these closed doors was extremely unethical, immoral, and unjust to these patients. So there was a lot of bad things happening in order to get the numbers up. Essentially, there was a lot of unnecessary deaths that were happening.
Mm-hmm. And people who watch Crowdsource the Truth regularly, there's a lot of people who actually came to the channel when I started going around New York City looking at some of these claims that hospitals were overrun. I actually went to Elmhurst Hospital to see what was going on. There was this article in the New York Times that had us all believing that it was, as I said, the epicenter of the epicenter. Dr. Colleen Smith was featured in this report. When I went to Elmhurst Hospital, it was amazing. It was one day after the New York Times came out with this report, or maybe it was a couple days after. I think it was the day after, as I recall, because I was shocked that the line was gone, the ambulances were all sort of waiting around, the EMTs showed no sense of urgency. Since then, I've spoken to other nurses who've told me that they were laid off. So it's a curious question for people in New York, particularly people who work in the healthcare industry. Why would they bring in nurses like yourself? It's got to cost a ton of money to travel you from Florida to New York. In the movie, I forget how I knew this, but it looks like you're in the Marriott Marquis Hotel here.
Yeah,
I mean,
right in
that's a
Times
very
Square.
expensive hotel, and Times Square is quite far from Elmhurst Hospital. Did they ever explain to you why that hotel was selected?
No, there was multiple. They had most of us nurses in hotels surrounding Times Square. I guess it was kind of the hub, and then they bussed us, to hospitals all over the city. Specifically, all of the hospitals associated with New York City Health and Hospitals. So these are hospitals geared towards taking care of the lower income populations, so minority populations, Medicare, Medicaid patients.
Right.
So that's the company that I was with was Crucial Staffing, and they were funded through FEMA. So that was, their area is to just put all the nurses throughout the New York City Health and Hospital system, which on a good day was already a really bad system, and it
Right.
continues to be a really bad system.
Yeah, right. I just want people to see, this is the New York Marriott Marquis Hotel here. It's a very expensive premium tourist hotel in the middle of Times Square, which frankly is quite far from Elmhurst Hospital. I want people to see where that is. Elmhurst Hospital Center in Queens, as Google Earth takes us there. How long did it take you each day to travel to the hospital by bus?
Like 30 or 40 minutes. Yeah.
Wow. So an hour round trip for nurses during a time when there's a pandemic. There's got to be tons of hotels in Elmhurst, Queens that would be way less expensive to house people in. I'm just very curious why Crucial Casting would have chosen to put you there. I don't know if FEMA is good at, utilizing resources. It was quite wasteful. They were also seemingly in charge of this USS Comfort that was parked there. We've heard a lot about how Andrew Cuomo put infected patients into nursing homes. Did you have any insight into that particular aspect of the story?
I knew that was going on because nurses talk, and so we knew that these patients were being put back into nursing homes with immunocompromised, and we're just the little people. Like, they don't listen to us, and if you do say anything about it, they send you home. So I just have a really hard time comprehending how he's been now nominated for an Emmy.
Yeah.
I feel like we are literally living in a twilight zone, and nothing makes sense. And anybody that does talk about the truth, is automatically, censored. They censor this picture. Yeah,
Well, this is a picture I created. I took some liberties. This was my appearance with David Knight yesterday, where actually you came up in the conversation. I share your distaste with the in this case, the International Academy of Television Arts and Sciences for awarding Andrew Cuomo with an Emmy. Not only is it distasteful, Erin, because of his horrible performance, this is the first time a politician has ever been awarded an Emmy. Obviously, Emmys are given out to people on TV, and their choice for doing this is really upsetting. So I share your concerns about New York Health and Hospitals, and it is a state-run. I want to learn more about New York Health and Hospitals. It seems that they do run nursing homes. How can we find out more about this, you think?
Just the system in general. I did some digging since I've been home, and what was happening is before the pandemic, they were on the verge of having to shut down multiple hospitals. I actually think they, maybe not within the system, but they had shut down hospitals because of funding. So to have a financial incentive to admit COVID patients, $13,000 to admit, $39,000 to put these COVID patients on a ventilator. In some of the nursing homes, was $10,000 per death. So when you have a financial incentive, why, obviously that's going to be taken advantage of, especially with a system that is on the verge of failing. So the sad part about this is that it was done at the expense of people's lives. And that is why I'm speaking up, because they were creating these deaths. The majority of the deaths in New York and honestly around the world were due to the treatment protocol or the lack of treatment and gross negligence and a lot of order followers that didn't uphold their oath, and so it's going to take a lot more people to start speaking up and make sure that, this never happens again. And, the people that called the shots, Cuomo, is one of the big ones, needs to be held accountable for what they did. And,
Right.
That's why, you and I are here, talking about it, because it does need to be brought to light, because this was murder.
Yeah. Well, it's definitely a damning indictment. I want to talk a bit about definitely Andrew Cuomo And this Emmy win, it's very, very troubling. I want people to understand what's going on here because, the International Academy of Television Arts and Sciences, they issued a statement where they said that he was being awarded, I'm trying to find the actual Emmys, here it is, New York Governor Andrew Cuomo is awarded an Emmy. And the things they had to say about it were remarkable. They're saying he's going to receive an international Emmy. They make a point of telling us that it was for his 111 daily briefings, and they worked so well because he effectively created television shows with characters, plot lines, and stories. I don't know that we want characters, plot lines, and stories from our governor. We want facts and we want action. So here's what I want to ask you about. We heard about, also from the New York Times, Dr. Colleen Smith, who was an ER doctor there at Elmhurst Hospital. Did you work with Dr. Smith at all?
Yeah, I met her actually on one of my last days in Elmhurst. I met her when I got transferred over to the emergency room. So she is she's a hero in that hospital, and people really respect her. Here's an interesting thing about her. So they were overwhelmed. The emergency room did flood with people who were terrified. Right. I mean, they showed up and people were scared, off the bat. And already Elmhurst is a very underfunded. I mean, you can go on their website and read the reviews and they're bad. Like this was pre-pandemic, very, very bad hospital.
It's a state-run hospital. Yeah. Andrew Cuomo, New York Health and Hospitals. This is one of their facilities.
Yes. So they were overwhelmed and they needed money. So this entire system runs on under a union. So there's a nurses union and so on and so forth. And what Dr. Colleen did is, she essentially was also an internal whistleblower saying, we need funding. You guys are, we need help. And so they actually were going to fire her, the administration, because they didn't want to look bad. And there was all the nurses in that emergency room said, listen, if she goes, we all go. So that actually saved her job. But I have a lot of respect for that Dr. Colleen Smith, for doing what she did, and she maintains her job there. So, I mean, there's a lot of good nurses and doctors, that are trying their best, but they can only do so much under a system that doesn't care about them, so.
Well, let me just ask you this, because we've seen this video from the New York Times. Are we looking at the ER here at Elmhurst Hospital?
It looks that way.
Right.
Yeah.
Now, why would a patient, first of all, every medical professional I've shown this video to is flabbergasted that a doctor would be running a video recorder in the ER. I note it's very strange to see a patient in a bed with their sneakers on. Isn't that an anomaly?
Yeah, I mean, I wasn't there during this time. I just was, it's what a lot of the staff that I met, while working there told me. But, Have you
ever seen a patient in a medical emergency room, even in a war triage? They don't leave their sneakers on. I mean, this is bringing contaminants from the New York City streets right into the ER, isn't it?
Yeah, but I mean, their sanitation guidelines in that entire hospital is pretty much non-existent. So I guess in a situation like that, in a hospital like that, anything kind of went,
They don't take the shoes off of a patient? I mean, that seems pretty bizarre. Yeah. The other thing is, it's interesting, the really smooth video footage we have here from Dr. Colleen Smith, carefully avoiding any patient faces. She's saying, look at this, they're all COVID patients. We need more ventilators. She was leading the charge for ventilators. And we later learned from another doctor, the guy who was talking about ventilators.
Cameron Kyle-Sidell?
Yes, that's the guy. So he produced a bunch of YouTube videos in which he's got, right here, 849,000 views, where he's speaking out. He's got the warning from YouTube that the latest information is available elsewhere, but this video has 800 and something thousand views. and he's talking about how these ventilators were killing people. Have you communicated with Dr. Kyle-Sidell at all?
I've tried. I actually shared that video early on too, because like one thing that medical professionals are supposed to do is, science is never settled. So especially like during, this pandemic, it almost feels like he was shut down. Anybody that questioned the norm was shut down. If you questioned, I don't think these ventilators are working because they're killing 100% of the patients at this point. At Elmhurst, that was the case. Nobody wanted to hear it, so that was one of my red flags too, like knowing that there was doctors saying, listen, we're doing it wrong. And then just nobody even is paying attention to the fact that, yeah, maybe ventilators aren't the right treatment. And they just kept doing the same thing over and over. It's literally the definition of insanity. And just, continued to essentially just kill these patients, for greed. There's financial incentive to put them on a ventilator. So why listen to Dr. Cameron Kyle-Sidell, or why listen to any, nurses that, are just, screaming like you're doing it wrong. We can do better,
It's strange though, because when we've put out videos with doctors like Dr. Judy Mikovits, they get immediately removed from the internet. But yet Cameron Kyle-Sidell, his video is able to accumulate 850,000 views. Certainly that could easily be removed by YouTube or any hospital that he works for complaining about it. I mean, I'm getting complaints from YouTube all the time. It's just strange to see how some of these videos grow to remarkable viewership without being removed, despite seeming to present information that goes against the mainstream narrative. The other thing I wanted to ask you about Elmhurst Hospital, Dr. Colleen Smith, in her own LinkedIn bio, describes how she's an expert at medical simulation, and Elmhurst Hospital has a simulation center in it. Have you seen anything related to this simulation center?
No, I didn't see anything like that.
But in your video, your movie, you describe how there were times that you were caused to leave a room and then the patient died and you don't really know what happened. You're not a coroner, you're not filling out the death certificate. Is there any possibility that what you witnessed at Elmhurst Hospital was a medical simulation?
Quite possibly. I mean, I wouldn't put it past anything. It could be at this point. I mean, it literally does feel like a movie. And maybe that's why Cuomo was granted an Emmy, because it is one. I just, none of it makes sense, honestly. And maybe I'm just, I was a character that wasn't supposed to be there. They didn't plot for me.
That's what I'm trying to get to, because when I look at other videos featuring Dr. Colleen Smith, she gave this presentation back in 2018 about simulating trauma. And I have to say, somebody moving through the ER with the smooth cinematography on a cell phone that was demonstrated in that New York Times video, it's suggestive that that's someone who is adept with technology. And in this video, we see that Dr. Colleen Smith can't even run the remote control for her PowerPoint presentation. So that doesn't really prove anything, but it doesn't really seem to fit with someone that would be able to just pop off an excellent professional looking video in an ER where patients are wearing shoes, and every doctor I've shown it to finds it absolutely astounding that a doctor would do that. I don't know if you're aware that Dr. Cameron Kyle-Sidell told me in a phone interview that he was actually, Dr. Smith was his resident. What can you tell us about the relationship between a doctor and the resident?
A doctor has to oversee a resident. So residents aren't quite ready to be on their own yet. They're still learning. They still need to get their hours. It's a process to be a doctor and be responsible enough to be able to make medical decisions without, having oversight. So Dr. Cameron Kyle-Sidell was was, the essentially a teacher, so that's.
But it's a very close relationship, isn't it, between the doctor and the resident? They spend a lot of time together, hard work, late hours. They get to know each other quite well. I'm sort of leading the witness. I'm guilty of that because my uncle is my uncle today because he was my father's resident. And he insisted, or rather my father's sister insisted on a date. So it's a very close relationship. And when I asked Cameron Kyle-Sidell if he had ever been involved in a medical simulation with Dr. Colleen Smith, he said, "I don't know." And then he freaked out and hung up the phone. And then he called me back to apologize for hanging up. But he basically refused to answer the question. And I'm not accusing anybody of anything, but when I see these kind of anomalies, like his video being allowed to stay on YouTube and accumulate 850,000 views, even though people aren't subscribing to his channel, all other videos seem to have been deleted by him. There were a series of videos there. I feel like there's something strange about this, and I really want to find out more about it because there was this whole push-pull going on with the ventilators. We need ventilators. He's saying we don't need ventilators. They know each other. It almost seems like they create these deliberately adversarial conditions where there's one person on one side of the argument, the other person on the other side of the argument. But actually, what's going on, the whole argument is fake, concocted, and there's some other goal that they're trying to reach. What do you think about that?
I mean, you make a good point. I actually I didn't make the connection between those two doctors like you did. So I didn't know that actually. So that is interesting. I think a lot of this is to just create confusion. A confused person is a good sheep. They'll listen to what they're told at that point because, that's how they base a lot of these, I don't know, scare tactics, and on fear, on a person's unknowing, what to do in each of these situations. So, I mean, I don't put it past that this is a movie and we're all in it,
Yeah.
And,
and certainly the Emmys agree with you. They award the governor for putting together effective television shows with great stories and characters. And of course, we did a protagonist and an antagonist for any good story because there's got to be drama. And certainly they want to introduce someone. They know there's a lot of people who are no longer watching CNN, no longer watching Fox News, no longer listening to the New York Times and their ridiculous multimedia presentations that present Dr. Colleen Smith in a particular light. Did you know that Dr. Smith, I can't recall if this was when you were there, but I was communicating with Dr. Smith and I asked her about her time at the University of Chicago where, you knew that she went there?
I didn't. Mm-mm.
Yeah.
I'm learning today.
Yeah, I asked her if she had interacted with Michelle Obama, who was the dean of students at the time that she was there. She didn't want to answer that question. I also asked her if she ever interacted with Bernadine Dorn, who was an alumni of Chicago University, and she blocked me on Twitter. So I started posing some of these questions publicly, and then the New York Times tweeted that Dr. Colleen Smith actually had COVID-19 and mild symptoms. When I tried to contact the media office at Elmhurst Hospital, only 9 days later, when Dr. Colleen Smith was back to Twitter, publicly tweeting about how she was treating patients, I asked the media department of the hospital what their policy was on COVID-19 positive staff members. Did they ever tell you any official policy if you got COVID-19, how long you'd have to stay out of work or anything like that?
They would quarantine you. I think they would at least 1 week, if you tested positive, but they never tested us. So
they never
I guess if you wanted to be tested, you could, but they didn't test us. They didn't offer tests, just to do it. It was, if you were symptomatic, you could go get one if you wanted to, but
I mean, you guys are there in the emergency room dealing with snot and vomit and all kinds of things that most people don't come into contact with. And then Wow, only a week of quarantine. They would not tell me that. They wouldn't give me any official information about quarantine. And it seems to me if they wanted 15 days to stop the spread that's now turned into 8 months, letting the doctor back into the ER after only a week seems like a substantial risk and threat to so many of these patients. The reason I brought up Bernadine Dorn is because there was another medical professional who came forward. Did you ever speak with this woman? I think her name was Nicole Suratek.
Yeah, her and I have become really good friends after all of this, so I speak with her quite a bit.
It was really difficult to reach her. When this video first came out, she was saying she wanted to get it out as far and wide as she possibly could. I'm generally pretty good at getting people's phone numbers, but I couldn't locate her at all. She is at Lincoln Hospital, which is another component of the New York Health and Hospital system. I don't know if you're aware, but in the 1970s, Bernadine Dorn's Weather Underground actually took over this hospital and turned it into a methadone clinic, sort of a terrorist takeover of a hospital. You knew about that?
Yeah.
So what happened to Nicole Suratek? How are people able to make these public statements accusing hospitals of murder and negligence, and the hospital says nothing?
Because they know. I mean, they know what they were doing, and they know we're right. Nicole, after this video went out, I was actually still at Elmhurst Hospital when her video came out, and I was so thankful to see it. I'm like, oh my gosh, I'm not crazy, because like, you literally feel like you're living in the Twilight Zone, and everybody's just okay with what was happening, and nobody's saying anything. So when Nicole's video came out, I was so happy, but I was still at that point, undercover. I was still getting video. I needed to get as much video and audio and proof as I possibly could. So it was really hard to watch her and see the amount of hate that she got after that. So she did shut down for a little bit. She's back now, so I could get her in contact if you wanted to interview her too. But ultimately, when I came out, I asked her if she would be willing to start speaking up again, and that she's not alone anymore. And she was like, yeah, we feel the same way. I mean, we saw the same exact things happening in two different hospitals. So, I mean, this wasn't just at Elmhurst. This wasn't just only in the New York City Health and Hospitals. This is happening globally. This is happening all over the world. And there are a lot of nurses now coming forward, as well as doctors that, are being brave and doing the right thing, to make sure that history never repeats itself.
And so the thing that's really confusing, we've heard about this crucial staffing. When you did an interview with Del Bigtree, that came up. You've just mentioned it earlier here. Is there a connection between crucial staffing and crucial casting? Because we've seen Lincoln Kareem going around the city. What is the connection between crucial staffing and crucial casting?
I'm not exactly sure, to be honest with you. That you make a good point, though. This crucial staffing company definitely needs to be investigated, because ultimately, they're funneling FEMA money and they're spending it in insane ways. It was actually funny. I recorded my final conversation with them when they said they were firing me essentially for speaking out. And at the end of the conversation, after they're sending me home, they asked me if I wanted to take a picture in front of their sign. Like it was like some sort of show. I'm like, absolutely not. I'm not taking a picture in front of your sign. So they wanted my picture at the end of the day, that I was a happy nurse working for crucial staffing. So it was, a lot of it was for show. I mean, look at what they did. Frontline nurse, front lines, we're like heroes. Like nothing we were doing or anybody was doing, it was hero work. It was murder, and so I guess if you say something enough, people will eventually begin to believe it. And that's pretty scary. It's just conditioning of the human mind.
That's actually a very well-known propaganda technique. It's interesting that crucial staffing was looking for 3,300 nurses and nurse practitioners. a lot of questions about crucial staffing. There also seemed to be this move afoot to create this sense that COVID-19 was somehow affecting people of lower income, which makes absolutely no sense. Obviously, a disease doesn't know how much income you have. You know, when you walk on the New York City subway, you've got people ranging from, you know, somebody with millions and millions of dollars to a homeless person, and they're interacting, breathing the same air. It just doesn't make sense to me that any sort of social or economic divide could create this sense. It was also really interesting, some of the language that Nicole Siratek chose to use. She was talking about a black patient who she referred to as my black guy, which other people have told me perhaps this is pretty standard parlance among nurses, but it seemed somewhat insensitive. And again, I just can't understand how some of these videos are able to stay here online and accumulate millions of views while others get removed so quickly. I don't imagine you would have any explanation for that, but let me just ask you something else about the book here, Erin, because I think a lot of people are very interested to read this. I get it that you say the hospital doesn't object to the accusation that fraud, negligence, and greed led to unnecessary death, because you're saying that they say that's true. But it just seems remarkable to me that lawyers for the publisher of the book would allow you to make these conclusory statements. I mean, doesn't it open the door for them to be sued like crazy?
Well, one thing that I have is proof. You know, I have video proof, I have audio proof, I have photos. So they've seen it. You know, the attorneys that went through the book, my attorneys, you know, it's all backed up. You know, these are not just claims. This is proof, and they know it's, you know, it's true. You cannot. There's no justification for what happened. So, I mean, that's why they felt safe putting this out.
Right, but I mean, aren't attorneys even, I mean, I want to just correct you briefly. You've got evidence. It would only be determined to be proof if a court, you know, adjudicated a case and determined that your evidence was substantial to meet the burden of proof. And I just find that lawyers are just super nervous, even if you do have evidence. It seems to me that they would have advised a title with a question mark, something like, did fraud, negligence, and greed lead to death at Elmhurst Hospital? It just seems like an inflammatory title, particularly when we consider that in 2018, Skyhorse, your publisher, entered into a distribution agreement with one of the nation's largest publishers, Simon & Schuster. I'm really surprised that Simon & Schuster would distribute your book with those kind of conclusory accusations. The hospital has said nothing to you. They haven't tried to block this book. The doctors that you recorded against their will haven't tried to get the video taken down from YouTube. How has all this happened?
No, I've gotten some lawyer letter. Well, my attorney has gotten some lawyer letters from New York City Health and Hospitals requesting any and all of my audio and video files, which obviously we said no. But other than that, I haven't, you know, they haven't done any, I haven't seen anything else.
So one letter from the hospital's lawyers that you declined, and that's it? They gave up?
Two letters. Yeah. They gave up. Mm-hmm.
Wow.
Yeah.
So they just said, please give it to us, and you said no, and they were like, okay, and they went away, and they're okay having these accusations of death and negligence. And what about the individual doctors whose reputations are, I mean, you're accusing them of murder.
Mm-hmm. I mean, I didn't come forward with any doctors' names per se. They know who they are. And you know, they're being investigated in their own time. So, I mean,
are they being investigated? Do you know that?
Yes, they shouldn't be doing what they were doing, you know, regardless if it's a liability-free environment or not. They have an oath to uphold. And if there are people dying because of their lack of ethics and compassion for human life, then they shouldn't be taking care of people, you know. And so if we don't want this to continue happening over and over again, then it needs to be looked at, and they deserve.
Erin?
Yeah.
Did we lose you? Yeah. No, I agree with you on that. Certainly, this was a unique circumstance where people were given immunity, as you're describing, and weird laws or edicts were being passed. So I'm very interested in what you're saying about this investigation into the individual doctors. Do you know who's conducting that investigation or how we could learn more about it?
I can't really touch on that right now, but when I can, I will definitely reach out again, and we can discuss that more in detail. But I can't really go into the specifics of it, but it is being looked at.
And have you been in touch with Journeyman Pictures since they released this documentary? Have they received any I would imagine the governor or any of the doctors shown in this video could easily have it removed from YouTube, yet it's been there since June, 1.5 million views. It's impressive performance, and you're doing and saying all the things that YouTube normally would put a warning on this video or remove it for questioning, the CDC and all this kind of stuff. It's weird to me that there's been no resistance from the hospital, from YouTube, from the individual doctors that are named. We've got this push-pull argument with the ventilators. What does Journeyman Pictures say about that?
I'm not sure. I know that you can't search it. So if you went to YouTube and you actually searched for it, they make it very difficult. But I'm not sure. Maybe it's because I went so public so quickly that to take it down would admit guilt. I'm not sure, and I haven't been directly in touch with them much since the video first came out. I do believe that it's probably had a lot more than the 1.5 million views that it says, because it was up I think it was up right around there within a couple weeks. So
and it took a lot of courage for you to come forward. You didn't know what would happen. Initially, you were kind of in secret communication with Jason Burmis, right?
Who? I don't.
Jason Burmis, were you? I thought you were speaking with him. No, he made some reference to speaking with an undercover nurse at Elmhurst Hospital. That wasn't you?
No, I don't recognize that name. So Is there another one? I don't know.
No, I mean, I thought he was talking about you when he mentioned that he was speaking to a nurse at Elmhurst Hospital who was revealing stuff. And I mean, it's understandable that you'd be reluctant to come forward. How did you put together all of this, secret recording equipment? You had glasses with a video camera in them or something like that?
Yeah, my attorney purchased them for me, dropped them off at the hotel, the Marriott Marquis, as a birthday gift, and so I put them on and started documenting. So it was actually pretty terrifying, but there was other nurses that came forward. Look at, even Nicole, it was all here. It's all hearsay unless you have proof. So I had no other option. If I needed to expose what was happening, and the only way to do that was with the video. So that's what I did.
And nobody noticed, right? A lot of these glasses are pretty obtrusive. I've used almost all of these undercover spy glasses, and the biggest problem I've had with them is that people notice in about 1 second that you're wearing weird glasses.
Well, we were all wearing weird glasses though, because it was kind of with our PPE. We had to wear protective eyewear too. So I made them like they were my nerd glasses, like it was a joke, and so people didn't really think twice about it. Everybody was in eyewear. So it made it easy to be able to wear something like that and not look, out of place.
Pretty clever. So, but the individual doctors who are pictured in the video, whose reputations are being impugned, none of them are bringing lawsuits against you or the publisher. I would think the publisher would be a ripe target for a lawsuit. This is the type of thing that lawyers love to do. They wouldn't necessarily want to sue you as an individual, but a publisher, particularly one that's distributing with Simon & Schuster, that is a rich target for a lawsuit.
Yeah, I haven't heard of any threats of a lawsuit or any upset doctors. I mean, we kept their identities really pretty hidden from the public, but I guess they know who they are in the video. So if they come forward, then they admit, that, yeah, I did that, so it's one of those things, I guess, if you're mad about it, then you probably shouldn't have done that,
Right. Yeah. So what else, Erin, can you tell us about what's been going on since you left New York? Are you still working as a nurse? Has the publishing of the book affected your professional standing or anything like that?
Yeah, I mean, well, I was obviously fired up in New York, and since then, they didn't want me back at my hospital here in Florida. So I still have my license, but I am essentially kind of blacklisted from any mainstream nursing job, probably for the rest of my life, which, I expected. So I'm just, it's worth it. I would do it all over again, and probably better if I could, just because this should have never happened. And it should definitely never happen again, especially, now they're trying to create a second wave. So is this gonna result in the same type of process happening inside these hospital walls with no family, and probably, so at least I could have opened some eyes, and, more healthcare professionals can be brave and feel, like it's their duty to also come forward and make sure that we save patients, and not injure them or kill them.
Yeah. I mean, I'm surprised by your comments about Dr. Colleen Smith. She was such a big proponent of the ventilators, and I haven't heard her come forward and speak out about not using ventilators, and she's done other things that caused me to believe that she seemed to be part of a social engineering operation, might even call it a simulation, staged by the New York Times, published as a multimedia piece here. It's so strange to me. When's the last time you spoke with Dr. Smith?
I mean, that was back in May. So all I know is that she went public because they needed help. And that was bold. Now, I didn't know a lot of this other stuff about her. I'm learning this right now. But I mean, what you're saying does make sense. And that, was this a big show? Yeah. And did she maybe, and just sitting here kind of thinking about it right now, like, did she come forward asking for money because they asked her to ask for the money? So obviously they needed funding, and that was a great way to be able to get it. So, yeah, I mean, makes sense. Yeah.
Yeah. And I mean, the audience detects, as you might as well, Erin, I've been a bit probing in my questions of you because there's something fishy going on at Elmhurst Hospital, and it's possible that you were a victim of this, possibly unwittingly brought into the simulation. People are saying that you spoke to Del Bigtree, not Jason Burmis. I'm well aware that you spoke to Del Bigtree. I'm speaking about something that Jason Burmis said that led me to believe that he was in communication with you. That video that you did with Del got deleted when his channel was taken down, but he had also spoken about crucial casting and basically things that you're saying right now here again. There's a lot of trolls in the comments. I'm sure you're very familiar with that. I think we've covered everything that I wanted to discuss, Erin. Is there anything else you wanted to share with people? What are you working on now? I know you were very active in raising awareness of dangers of some vaccines in the past. I was surprised that you and Del didn't go into that at all. Did you know him from your vaccine activism?
Yeah, no, I knew Del a couple of years, ahead of this stuff. But yeah, I mean, I'm definitely very outspoken about vaccines, especially right now with this COVID vaccine that they're trying to push on people, for a show ultimately. It's going to end up really creating the second pandemic if people race for it. But Yeah, I mean, I'm happy to discuss any of that at any time. And as far as like the trolls go, it's expected. That people don't like the truth, and this is their way of trying to silence anybody that's trying to tell the truth. And if anything, they motivate me to be even louder. So I've been public speaking every weekend. I try to, get out and talk to people and share the truth and encourage other people to be brave and come forward if they know that something's wrong, and speak up and say something.
And the book, of course, it's called Undercover Epicenter Nurse. People can purchase it wherever books are sold. Amazon, of course. Is there any other websites or any other links you want people to know about, Erin?
I have like a mailing list. If people wanted to go to nurseerinwellness.com and send out, some information every so often, that if they wanted to stay in touch that way, because it's going to come down to eventually here I have to switch that video, it looks like. It's going to come down to everybody being censored, so this is a good way to be able to keep in touch. And
well, thank you for speaking with me today, Erin. I know people are very interested in following your story and trying to find out what's going on over there at Elmhurst Hospital. I agree, something fishy is going on, and it has been since this pandemic broke out. Thanks for joining us today, Erin, and thanks everybody for watching.